Hello, and welcome to Population Health Plug-in, a show highlighting current public health topics in our community and things of interest to students across the university. My name is Mina Nabavi, and I am a program manager in the Office of Public Health Practice at the UAB School of Public Health. Today, we have with us Dr. Lisa McCormick, Associate Professor in the Department of Healthcare Organization and Policy and Assistant Dean for Public Health Practice in the UAB School of Public Health. So thank you for being here today and taking time out of your schedule to talk to us about an exciting opportunity that's coming up this summer or next summer for graduate and undergraduate students in the School of Public Health and across UAB. So you have developed the first faculty-led travel course in the School of Public Health. It's called Exploring Population Health on the Road in the Deep South. So congratulations.
Thank you.
Can you tell me a little bit about it?
Yeah, it's been a really exciting time, and I hope that students will think this is going to be an exciting course. So this course will provide students an opportunity to learn about both historical and contemporary public health issues, the things that we've been discussing in class, their effects on population health, and how public health systems are working to solve priority health concerns in their communities today. This course is really going to focus on the Southeast United States, as you mentioned. Students will tour historically significant sites, visit communities and community-based organizations, attend featured presentations around both contemporary and historical public health issues, as well as visit local, state, tribal, and federal public health agencies to learn about their structure, programs, service delivery models, and approaches to addressing public health issues.
Exciting. So who can register for this course?
So this course is open to all students across the university. In any discipline or degree track, graduate and undergraduate, so public health and non-public health majors. We really want this course to be truly interprofessional because the solution to the issues that we face in our community today are really going to require cross-sector collaboration in order to create positive change. So the course is going to be limited to the first 20 who apply and pay their deposit. So we can't really take more than 20 on the road with us. So register early and get your deposit in.
Okay. So I know it's across the Deep South or across the Southeast. So where specifically will you be taking students, and when does this course take place?
So we are going to be traveling to locations in Mississippi, Louisiana, Alabama, and Georgia. The course is going to take place during the May mini-term in 2018. We're going to spend the first week in class talking about the communities we will be visiting and the issues that we will be discussing on the trips. We will leave Birmingham on a Sunday evening to get to our first destination to start Monday morning, and we will not return until the Friday of the third week of the trimester. So we will be on the road a solid 2 weeks.
Oh, wow.
And then the last week we'll be back in the classroom and having some post-trip follow-up discussions and really putting together a presentation that will be presented the next fall as part of our seminar series here in the School of Public Health.
Okay. So can you tell me about some of the places you will be visiting or some of the people you'll be meeting with?
Yeah, so this is something I think is really exciting. We're going to be visiting state, city, tribal, and federal public health agencies. We're going to visit the Mississippi State Department of Health, the New Orleans Department of Health, the Porch Creek Band of Indians in Atmore, Alabama, their health department, and then we're going to be visiting the CDC's campus in Atlanta. We are going to also be meeting with faculty from different colleges and universities around the region to discuss some of these priority health concerns and issues that they're working on. And we are going to be visiting with community-based organizations and others that are part of our public health system that are working to really affect public health issues in communities today. Okay. So specifically, we're going to start off by visiting with those working to end the HIV epidemic in Jackson, Mississippi. We're going to learn about tuberculosis, the historical and contemporary trends, and really discuss issues around antibiotic resistance. We're going to meet with representatives from the Mississippi State Department of Health's Division of Radiation Control to discuss environmental monitoring of a site in Baxterville, Mississippi, where in 1964 they detonated a nuclear weapon in the Tatum Salt Dome, and today they are still having to monitor that site. So we're actually going to visit that site and the people responsible for monitoring and really talk to some community members about kind of public health concerns that they have about the site. We're going to talk with community members about the benefits of community gardens, and we're going to hopefully meet with some chefs in New Orleans who are working to cook culturally appropriate food in a healthier manner and hopefully be able to taste some of that fare. We're going to discuss poverty and disaster outcomes and the challenges of recovery in New Orleans since Hurricane Katrina. We're going to visit Fort Massachusetts, which is on Ship Island off the coast of Biloxi, Mississippi, which was the first quarantine station in our nation, and really talk about the differences between quarantine and isolation. We're going to visit with the Dauphin Island Sea Lab to discuss the effects of the BP oil spill on the Gulf of Mexico and discuss microplastics and their in the oceans and their effects on our food chain. We're going to visit Tuskegee and the Legacy Museum that is there to discuss ethical issues around human subjects research, and hopefully have a speaker that will talk to us about racism and its effects on health equity. We are going to be visiting Auburn University and touring the Animal Diagnostic Laboratory and really being able to discuss with some of the faculty there in the School of Veterinary Medicine about the intersection between human and animal health. And then when we get to Atlanta, we want to talk with representatives involved with the Atlanta Beltline Project, which is a greenways project outside of Atlanta. We are going to visit the Georgia Poison Control Center, and hopefully talk with some folks at the Atlanta Zoo about issues around venomous species being imported illegally into our country and what that means for our public health and safety.
Oh, wow.
And then we're back to Birmingham. Now, all of this is subject to change, different folks' availabilities on different days, and it could change depending on emerging public health issues that arise between now and May. There may be some issue that comes up that we want to spend more time on versus some of these others, but the loop will remain the same. We'll go from Birmingham to Jackson, down to New Orleans, back across and up to Atlanta, and then back to Birmingham.
Oh, wow. And you mentioned several places and events, historical events that I had no idea about. So it sounds like a great trip. So students are not only traveling, but they'll actually be earning course credit. Is that correct?
Sure. So students will earn 6 credit hours through PUH 492 and PUH 690, depending on whether they're an undergraduate or graduate.
Okay.
So public health undergrad students will have an opportunity to substitute this course for PUH 495, which is the public health capstone experience, and public health graduate students will have the opportunity of substituting this for PUH 695, the integrative experience, which is the graduate capstone course.
Okay.
So both undergraduates and graduates should talk to their program coordinators or advisors in their department to see how the additional 3 hours of credit can be used as electives in their degree track. And for non-public health majors, please discuss with your advisors to see if this course can substitute as elective credit for your degree tracks.
Okay, so I know the next big question is going to be cost. So what does this trip cost and what does it cover?
So the cost of the program is $1,664 plus tuition and fees. So the $1,664 includes transportation, housing for 2 weeks, breakfast, admission to historical sites, and 2 group meals. We're going to do 1 group meal in New Orleans and one group meal in Atlanta the night before we come back to Birmingham. So students are responsible for all additional costs, such as the other meals and incidentals on the trip, and of course tuition and fee costs.
Okay.
However, I do have some good news. The first 10 students who register for this course and place their deposit will receive a $500 travel stipend from the School of Public Health. And you do not have to be a public health student to receive this. It's just the first 10 students who apply and pay their deposit.
So students need to sign up quickly in order to take advantage of that.
Right.
That's wonderful.
Yeah.
So how and where do students go to apply? And are there any restrictions? Are there any prerequisites for students? And what are the deadlines? Sorry.
Okay. Yeah. So students apply through Education Abroad.
Okay.
Here at UAB, the web address is educationabroad.uab.edu.
Okay.
The application deadline is December 1st, 2017. So it's a full, by the end of this fall semester, you will have to have, have your application in and your deposit paid if you want to take this May mini term. And it may close sooner because we only have 20 slots.
Okay.
So once those 20 slots are we have people registered and their deposits paid, we will close out the course. As far as prerequisites, undergraduate students must have completed their sophomore year before the May mini term begins. So just making sure that, they're about to enter their junior year.
Okay.
For graduate students, there are no prerequisites.
Okay.
So,
great. So where can students go to find out more information about the course or if they have additional questions?
Well, definitely visit Education Abroad's website, or you can email me at lmccormick, LMCCORMICK, @uab.edu.
Wonderful. Well, thank you so much for being here, and it was great learning about this course, and it sounds like a great course, and I hope students from all across the university sign up, and it just sounds wonderful.
Thank you, Mina.
And thank you for watching. Please tune in next time for another episode of Population Health Plug-in.